This meeting is being recorded.
Good morning. It is Wednesday, August 3. It is 9:02 a.m. We will be moving into council time agenda after our work session this morning, which is with the medical examiner's office for a Clark County fee proposal. So that's where we'll begin. Then we move into council time, and then we have three executive sessions that are planned after that. So that's what lies ahead. And Dr. Melnick, please begin.
Madam Chair, we have an awful echo. I don't know if the microphone is on in the chamber.
We just turned it off. Yeah, we just turned it off, so it should be fine now.
Thank you.
Good morning, councilors. Dr. Alan Melnick, I'm the Public Health Director and Health Officer. We're bringing this fee proposal to the work session. I'm going to ask Andrea Pruitt, our Community Health Director, to go through the presentation here and the proposal. And I'm around, and Jeff Harbison, our Administrative Services Director, and Kayla Mobley, our Financial Operations Manager, are also available here to answer any questions you might have. So I'll turn it over to Andrea Pruitt to lead us through this.
Good morning, counselors. Thanks for the opportunity to revisit the discussion we had a couple weeks ago regarding a fee proposal to help index some of our department operations. Could we advance to the next slide, please? Great. And so again, today we will provide an overview of medical examiner office functions and current community conditions that are impacting county operations, specifically capacity building for our death investigation and administrative functions. We'll discuss and propose a fee structure for your review and approval, and also review current and future risks and liabilities related to infrastructure and staffing. Next slide, please. And just as a general reground and overview, our medical examiner office provides medical, legal, death investigation, and forensic pathology services to determine cause and manner of death for decedents where our office assumes jurisdictional authority over deaths defined in RCW 6850. Next slide. And this list is also available through the RCW statute that's hyperlinked. And these are some of the jurisdictional death circumstances which the office typically takes jurisdiction over, and includes unlawful, unnatural, suspicious circumstances, violent deaths, and people in apparent good health who die suddenly. So this is the list. It's not exhaustive, but this is typical, please. So in terms of what we've been observing, and there's some slides with data to support these inputs and implications and the opportunity to establish a fee structure, Clark County is observing population growth. And as such, we are also observing more age-distributed deaths as a function of that population growth, which is expected. We're also observing rising death rates relative to this population growth, all cause and unnatural, which that increase is more than what we would expect given the local population growth. And we're also aware that Clark County will experience long-term general fund structural deficits, which will also have implications on our capital structure and which will eventually compress and provide constraints on our autopsy capacity throughput given these increased service demands. Next slide, please. So is there any way that we could make the full slide available right now? There's a little bit of that graph that's got to have access to.
Andrea, sorry, this is Kathleen. You're breaking up really bad. I don't know if maybe turning your video off might help, but you're breaking up really bad in your presentation.
Okay, is this better?
Yes.
Ah, fabulous. My apologies. Okay, so for this inputs and implications slide, we're not able to fully visualize it, or at least I'm not. Is there any way that we could, yeah, there we go. Okay, thank you. So following some of the conversations we had, there was a request to visualize the data. So we worked with our health assessment and evaluation team to be able to overlay those numbers that I spoke about on the previous slide. So Clark County has experienced an 18.6% growth between the years of 2012 and 2021. And then on the graph, you see there was an increase in total number of deaths that's disproportionate to the population growth, right? So we have a 59.5% increase in total deaths since 2012, but an 18.6% increase in population growth. And of those total deaths, for the year 2021, 908 of those deaths were not investigated, and those are the natural deaths. And those two categories below the gray trend line, that pale orange and that dark orange, those are the deaths that are investigated by our team. And then the dark orange are deaths that are investigated and we take jurisdiction over. So what's compelling about these numbers is that gray area, those natural deaths, we experienced a 20.7% increase since 2012, and that tracks pretty closely with the population growth, right? And so it's the rapid increase in investigations and jurisdictional deaths that are disproportionate to that population growth. So that 72.9% increase of the investigated deaths where jurisdiction was declined, and then the 71.2% increase in cases where we did assume jurisdiction and provide cause and manner of death. So that tells a story in terms of what we're seeing in terms of growth. So if we could advance to the next slide, please. And here's the data illustrated and visualized in a different way. And so here we provide rates, and rate allows us again to compare apples to apples. And the denominator for all three of these trend lines is the total population in Clark. So as the rate, and then the medical examiner case rate, for which those are cases which we assume jurisdiction over, you see those trend lines increase over time. And so right now, effective 2021, there's approximately 928 deaths per 100,000 people in the population.
You're starting to break up again. I don't know if you can be closer to your mic or something else.
Let me see. I'm trying to shut down some applications. I'm sorry, I'm having so much.
This is a good presentation together with our council time when we talk about broadband issues.
I'm glad I'm the example here of that issue. So my apologies. Is this at all better? Do you need me to call in?
That's better, but you may want to do the where you started on this slide, because we missed a bit of most of this particular slide.
Okay, so what we'll do then is I'll try to represent the slide. If I continue to break up, I will call in. This is the data visualized a different way. So here you see rates. I know we've had a lot of conversations about rates on our COVID-19 discussions. The rates allow us to compare apples to apples. So the denominator here is the Clark County population. And this allows us to conceptualize and visualize the death rate, our investigation rate, and our case rate per 100,000 people in a population.
Andrew, you may
So you
want
see
to
those
call in. We're
27.
losing you. We're losing you again.
Understood. Sorry about that. Calling in.
Andrew, I think it'll be better if you actually call in. I think it'll be better.
Yeah, I think.
Well, okay, I'm working on that now.
To your access code or
Andrea, is this you?
Okay, how's this?
Okay. I think we're good now. Thank you.
Absolutely. Okay, so I'm coming through. Nothing like the awkwardness of having to pivot mid-presentation to the phone. So, okay. So were folks able to hear the presentation piece about the rates and why this is an important way to visualize the
Yes.
data available to us? Okay.
Thank you.
fabulous.
Yes.
Okay. Okay, wonderful. Does anyone have any questions regarding this slide before we move on? Okay, hearing none, we can advance to the next slide. Okay, so given this data available to us, what we are recommending is the implementation of a fee structure. The fee structure, anchored by a disposition authorization process, will support the sustainable supplemental budget capacity that the office will need in order to maintain pace with the services we provide to the community relative to the increasing death rates. And so what this will allow us to do immediately is permanently fund our 1.0 project OA3, our 1.0 project autopsy technician, and then a new 1.0 death investigator. So this position will be added to the team if approved. Next slide. And here's that fee proposal that we are discussing. So out of all the medical examiner counties in the state, at present, we're the only county that does not implement or charge some type of fee for medical examiner services. And so we might want to zoom out a little bit. I think the disposition authorization fee at the bottom of the slide is cut out there. Okay, a little bit more. Can we minimize just one more click? Okay, there we go. So here's what we're proposing relative to our peers is a fee for autopsy reports, photo CDs, block slide recuts, biological specimens, and that disposition authorization fee. And so the disposition authorization piece of this fee structure is really what will anchor and sustain our ability to provide services over time to the community on par with the jurisdictional need in the county. Next slide, please. And so here again, to visualize caseload, right now, our death investigators who are responsible for that investigation and being the eyes and the ears of our medical examiner, you see over time the caseload per death investigator over 10 years. And in 2021, our death investigators had a caseload of 796 deaths per 1.0 death investigator. So we'd really like to operationalize this fee collection structure using these 10-year rolling death trends. And these projected fees will support staffing infrastructure and then index future needs in the event that we see continued growth. And what we'll do is we will create this ratio or algorithm that will standardize the caseload of all of our death investigators to 721 all-cost deaths per 1.0 FTE death investigator ratio. And there is an error here that would, if approved, we would operationalize this effective 2023. And this does assume that disposition authorization fee of $70 per death certificate. Next slide, please. And just for context, this is our current organizational chart for the service line, and those 3 positions that we discussed are highlighted in orange. And as you can see right now, we have a lead death investigator, 4 other 1.0 death investigators, and 2 permanent autopsy technicians. And so these 3 positions would be funded if the fee structure is approved based on data we currently have available to us in those 2021 numbers. Next slide, please. And for the operationalization and the logistics, the disposition authorization process would allow our medical examiner office staff to review all deaths that occur in the county. So if you recall on that first graph and the slide of that gray line of deaths, those natural deaths that we don't investigate currently, those would be rolled into the case rate algorithm of the 720 per 1.0 death investigators. And so before a death certificate is certified, medical examiner staff would review each cause of death identified on death certificates, and those death certificates are filled out by community physicians of record, and we would verify that that cause, what the person died from, and the manner, the type, and designation are correctly identified. And so in the event that there were circumstances that our team felt warrant additional review, we would be able to work with law enforcement to correctly identify and correct those death certificates. And so the fee would not be charged to the back to the county for deaths for which we which there are no next of kin. So we wouldn't charge the county back for that, and the revenues generated by the disposition authorization permit fee would support those operations and duties and functions of our staff for the medical examiner's office. And we would build logistics and the point of sale service on the existing web platform that Jeff manages as part of our administrative functions. Next slide, please. And as I previously stated, the benefits of the system would really be preventing the destruction of evidence in death investigations where we may make adjustments to the cause and manner of death. And that proposed code would require that all of those deaths are reviewed prior to disposition. This would improve community safety by reviewing potential suspicious deaths that would otherwise appear natural and allow us to create a sustainable budget capacity directly tied to need and ensure appropriate staffing levels and quality of service. And it will also support in the reduction of risks and liabilities, which I'll detail on the next slide. And so ideally, we've illustrated with the graphs in the presentation, we're really experiencing flat staffing and increasing caseload. And there's only so much compression that the team will be able to manage until we start kind of impacting other law enforcement allied service operations in the community. And there will be implications for fire, EMS, and law enforcement and chain of custody, longer wait times to attend scene investigations and complete case reports. And there will be impacts on our community members as well. For folks who are waiting for cause and manner determinations for their loved ones, moving on with closure, and then also really critical documentation required for benefit filings. Potential loss of name accreditation to the National Association of Medical Examiner Accreditation is critical to our ability to maintain office functions, as we will be required to maintain name accreditation in order to receive state reimbursement for forensic exams performed for adults and for infants. And so that would be a loss of 30% salary, and that's for adults. I think that there's 100% reimbursement offered for infant deaths under the age of 3. And then there's also increased staff burnout and increased turnover, and we want to make sure that our folks are supported and that we have minimum staff capacity, adequate staff capacity to make sure that we're able to provide high quality service to the community. So next slide, please. I think that's it. Counselors, do you have questions regarding this fee proposal?
Madam Chair? May I go ahead? Okay.
I'm off of mute. And yes, indeed. Please go ahead, Councilor Medvedev.
So first, I just want to start with a comment. The two main points I take away from this. One is every other county is doing this. It makes perfect economic sense to seek reimbursement. So I fully support based on that. The other areas, that this is a real safety net that a lot of people don't appreciate. You rarely get a battle of experts, forensic pathologists, where they dispute or have a contrary opinion on what a cause of death is. And this really doesn't weigh into this conversation we're having today. But that safety net, those cases that it really isn't clear whether it's a disease or malfactor involved in a cause of death. It could be abuse, it could be neglect. We're in every area, we need to have a safety net to do more of a review to ensure that we are comfortable knowing what that cause of death is. It's a public safety issue, ultimately, if we miss a child that died because of neglect or abuse and it just wasn't picked up. And we have had a notorious case pretty recently in the county, a few years, within the last couple of years, of that occurring. So we need to really increase that professionalism and safety net. So I'm in full support of this. My question goes to basically the last slide, where what I am seeing from that is, with these changes, you're anticipating that we are going to need more staffing. That would be step two. Okay, step one is we need to improve that safety net, make sure we're doing more reviews, but ultimately we're going to need more staffing. Is that my take on it? And is that correct? Do you have a projection of what other FTE you might need once these changes are made?
Yes, and that is directly tied to that algorithm or that case rate. The fees that we anticipate collecting based on the 10-year death trends and the population growth, it will index us. And I think working with Jeff, creating this caseload or this case rate, right, in terms of each death investigator will be responsible and it will be standardized for a certain number of deaths per year. So if there are more deaths, we will collect more fees, and those additional fees will be used to increase staffing. So we're really tracking tightly with need in the community. So yes, to answer your question, this is exactly what it will do. So the addition of those three positions that were expressed earlier in the slide deck are going to be what standardizes us to that caseload now. And in the event that there's additional growth, specifically for deaths where we will be doing investigations for unnatural deaths, it will allow us the capacity to do that and standardize it over time.
So, thank you. So those three positions will hold us for a while, basically.
Correct. Yep, absolutely.
What is the source of funding on the existing death investigator positions and others that were in the dark green on the chart that you showed us, the org chart?
That's an excellent question. The medical examiner's office is a general fund department. And like I said, we do receive reimbursement for the state for a portion of the exams that are performed by our pathologists as well. And so we currently have our chief medical examiner staffed. Our associate medical examiner position is vacant, but we also have support from locums tenens, physicians, and pathologists who provide us with pathologist support 1 or 2 days a week to make sure that we maintain autopsy ratios required for NAME accreditation. So primarily general fund, and then some reimbursement from the state.
And does that outside help continue to increase as our caseload goes up?
So that's such a good question, and so we had chatted about this in the one-on-one. There's an extreme forensic pathologist shortage in the nation. It's well documented, and it's a long-term issue, right? Because the glide path to become a pathologist, you have to go to medical school and do your residency. So it's a 10 and 20-year problem, right? And so we're very deep in this pathologist shortage. So we have contracts, fee-for-service contracts right now with 2 other pathologists, and they come as they're able. And the one pathologist provides support to coroner and medical examiner's office all around the state. And so he's very mobile and provides support wherever he's needed. And then the other pathologist that provides us with support actually travels to other states and flies in and performs exams. So if that's any, to give the council a picture of how acute and critical the pathologist shortage is in the nation. So we work with those 2 partner pathologists to take truly whatever we can schedule. And I think one of the pathologists, Dr. Nara, is interested in increasing the number of visits per month. So we're really hopeful and excited that that's something that we can move forward with while we look to recruit for that associate medical examiner position. And we're also working with human resources to do a salary comparison with other medical examiner offices in the state, so we can be competitive, so we can recruit likely folks that are going to be newer pathologists, so that we can bring and embed into the organizational structure. That will be really critical over time.
Thank you. Well, I guess we shouldn't be surprised that the difficulty of recruiting exists in this area too, which is very specialized.
Yes, I would say that this is probably the most specialized position we have anywhere in the county. So Dr. Burt is an incredible part of the team, and I think that the other team members listed on this organizational chart are incredible, and they're all doing an amazing amount of work and really support Dr. Burt to be able to complete those autopsies and maintain department structure. So, and we're working nationally, and we work with our peers in the state on the pathologist shortage. I think last time we checked, we were short 8 to 9 pathologists in the state. This is not something that's mutually exclusive to us or the state of Washington. King County has shortages, and a lot of times this network works together when you're down a pathologist or you're experiencing an influx of cases where you need support. And a lot of our organizations that we've relied upon for mutual aid in the past are no longer able to provide that support because they too are short-staffed. So it's definitely something that we're tracking. It's been nationally documented, and if you'd like more information on that shortage, we can absolutely forward you that information.
And I can just add, if I remember correctly, even a couple of years ago, I think there was only 500 to 700 people in the country with this area of expertise. So it is very a small number.
I think it may be half of that. The last I heard, it was about 350. Andrea, do you know what? There's a few hundred forensic pathologists nationwide.
I know it's a very small number. I'll get an updated number for the group. I don't know what it looks like effective 2022,
Yeah.
but it's not nearly the number of pathologists that are necessary to perform the medical legal death investigations. And so I think there were task force created at the federal level. It's something that's well documented, and the impacts are many, and our ability to be able to perform this critical service and to document the cause and manner of death cycles back, and it touches everything, right? It informs our healthcare, our prevention efforts, our ability to maintain our economy, all of it. So it's a rarely discussed, incredibly critical part of the infrastructure, and we're also really grateful for our law enforcement partners. I know that they've been working really closely with the death investigators in the field, given these increases in jurisdictional and just deaths that are reviewed. So,
by the way, as
very...
Andrea mentioned, the pipeline is long also. Now, medical school, then you do a pathology residency, and then you have to do a fellowship in forensic pathology. So it's multiple years. This is a problem that's not going away anytime soon.
And Nikki Casa did just message me and said that there are less than 600 board certified pathologists currently practicing. So that number is accurate.
Yeah, Kathleen had the better number. Sorry.
Yeah, Kathleen wins the prize on that one. So.
Madam Chair?
What other?
Yes, Councilor Rylander.
I have a couple of questions and maybe a comment or two. So because the ME's office comes out of the general fund, then the replacement funds you get here would free up those funds back to the general fund? I mean, the general fund would be less stressed? Is that an accurate statement?
No, that's a great question, and let me clarify. So the fees collected in the event that the councilors choose to approve this proposal will supplement the existing general fund budget. So essentially, those risks and liabilities and increases in unnatural and all-cause deaths, right, that's happening regardless. So the choice then becomes, the hard choice becomes, how do we problem solve a way forward given these constraints? And that was the inputs and implications slide. So this is a way that we can index our needs without asking for additional general fund money. But it wouldn't be kind of the gold standard, which you're describing as we would use this to reduce our current general fund budget allocations. So this would just maintain those over time. We wouldn't ask for more, but rather solve this increasing staffing need with a different fund source. So.
Okay, thank you for that. That actually is just important for me to understand, because if it was a trade-off, it's easier. If it's not a trade-off, then just an additional little thing to consider. Next, I noticed in your slide presentation versus other counties, Clark, King, Spokane, Snohomish, looked to me as if Spokane was maybe sort of a general better comparator than, say, King, just because of cost of living. I did a little quick look, and looks like King County has about a 50% higher cost of living than Clark County does, but Spokane is about 20% below Clark County. So from a comparator standpoint, fee structure, I would think something in the Spokane plus 20% or something. It would be a little more palatable using a county that was a little more comparative. So can you help me understand the not just the costs associated with slowing down the service delivery, but legal implications that go with that? I'm not sure that that's as clear as I would like it to be, because I'm concerned that if we get behind, that has impact on the PA's office and prosecuting cases, police investigations, et cetera. And so there's not just a dollar and cents aspect to this, there's a legal. So I'd be interested in any feedback on that.
Absolutely, and I think the legal implications are incredibly critical, and that slide that discussed the implications and the risks and liabilities gets to that. And so this fee structure, right, and I think what's important to note is cost of living is one thing, and then the rates of death and the type of death is something else that's incredibly critical. So Clark is experiencing rapid increases in unnatural death. And so about half of that can be attributed to accidental deaths, falls, overdoses, and transportation-related fatalities. And this is also inclusive of, and so those unnatural deaths, homicides, deaths by suicide. And so the increasing death rates are what's driving the need to increase and stabilize our staffing, right? Because if we keep our staffing, our death investigator ratios the same as we experience more excess unnatural deaths, then we will be ill-equipped and unable to meet the rising demand for services, right? And so that's exactly what you're talking about. There will be legal implications. Reports will be slower. We will be ill-equipped to respond to multiple scenes because we only have so many staff, and the office operates 24 hours a day, 7 days a week, call. So we need additional staff to be able to meet that rising demand and deaths. And we work very closely with the prosecuting attorney's office on cases, specifically homicide and anything civil that might pop up in terms of a lawsuit as a function of maybe a motor vehicle accident where the driver causing impact may be under the influence of substances and things like that. So I think there's immediate kind of day-to-day operational impacts, right? So in terms of our ability to respond quickly to the scene, if there's a scene that we can't respond to immediately, we can't, our partners at the sheriff's office and our allied police departments, they can't break chain of custody and leave a decedent in the field. And so if we can't respond and they can't leave, right, we're experiencing those distributed shortfalls. So it's kind of like a dominoes effect. So you ask great questions. And yes, I would argue that the legal implications and our ability to do work and respond and serve the community is the most critical part of this, right? So if we chose not to move forward with the fee proposal, we would still need to problem solve the staffing issue another way, right? There would be, it's a kind of a pay now, pay later construct. So this
just a couple more.
Sure.
Okay. A couple of weeks ago, I believe that in the discussion, the health department indicated you'd picked up some additional state monies. I don't remember the amounts. It was in the hundreds of thousands for additional personnel. Yes. Is that ringing a couple of weeks ago? Is there any type of ability to either use some of that money or those people, or are there additional grants from the state level that could be used to take care of these additional fee needs?
Gosh, I sure wish that was the case, and that's a great question. And I believe you're referring to foundational public health services dollars, and those cannot be used for this service need. There is one position that was approved under FPHS that will ensure, to Counselor Medvich's point, that all deaths that occur in children and youth from ages birth to 18 are reviewed. So there's 1.5 FTE position, our child death review coordinator, that was approved, but that is different than the direct service work that's happening in the office of the medical examiner. Those death investigators that go out into the field and work with law enforcement to determine cause and manner of death for jurisdictional cases, or cases that we need to determine whether or not we take jurisdiction. So FPHS it relates, but it relates at that like 100,000 foot level. Why do people die? Are those deaths preventable? And what do we do about it? So that's the public health side. And the death investigator and the medical examiner office side is very, very operational and immediate, and the office determines cause and manner of death. And then public health takes that data and applies it to reduce unnatural and premature death. So so that's just a long-winded way of saying we can't use that funding for this. And in terms of the grants, I'm always looking, absolutely always looking for justice and law enforcement and medical legal grants to be able to support these functions. The danger with grants is it's soft money, right? It'll buy you time, but it's a Band-Aid. It's not a solution. But to that end, we're always looking. And I think that's a huge part of my job, is to make sure that we're looking for all available sources of funding.
So just really quickly, the foundational public health services, there's a list of that. There's the grant funding, the ongoing funding we're getting from the state is specifically they're specifically defined, and unfortunately the medical examiner work doesn't fall into that definition.
Okay, and let me finish up with this. So is my following interpretation correct in that instead of going forward, if we were using the general fund, everybody sort of pitches in a small amount of money in the general fund. In this type of situation, what we're saying is that the costs are associated with the needs, the users. It's specific rather than general. It is specific to those who have a need, a particular circumstance. In addition to that, it is intended to be revenue neutral. In other words, you're not trying to build up a bank account, you're just trying to cover your costs. But I guess it's almost like I don't want to use the wrong word here, but if there's a user fee for something that the person who uses the service pays for instead of everybody paying for. I just want to clarify those two things.
That's correct. Yes, it's a fee that's charged at the event. It's not a tax, and it's not revenue generating. It's directly tied, indexed to the death rate. So if a death doesn't occur, we don't collect funding and we don't apply it to an unneeded position. So it's very tightly correlated with need in the community. Yes.
I just want the public to understand that we're trying to explore every opportunity and every aspect of this to make sure that we're not trying to pick up additional fees or services that are unnecessary or unneeded. I just want the public to really understand how deep we're digging into this. Thank you.
Yes, absolutely. I appreciate that.
Staff, when is it scheduled for the medical examiner's fee to come to council?
That is a
This will
great
be
question.
brought forward during the 2023 budget process.
If I can you hear me? Okay, this will
Yes,
require an ordinance, which we'll bring forward during a council hearing. And then Kathleen's correct, the budget impact would be in the 2023 budget submission.
Thank you. Are there other questions or comments from council? And hearing none, I'd just like to give the staff of the office a great big thank you for the depth and level of preparation for today's report. We appreciate it. I know the public appreciates it as well. Thank you.
Thank you.
Thank you, council.
Thank you.
Bye-bye.
Bye.
It is 9:44. Our agenda